Hello, everybody. We'll be starting our webinar right now. Welcome to the ADAA webinar. The topic for today's webinar is asking your pharmacist about medications for anxiety and depression. I'm Dr. Suma Chand, and I'm your host today for this webinar. I'm an associate professor in the Department of Psychiatry at St. Louis University School of Medicine, and I'm a clinical psychologist specializing in cognitive behavioral therapy. I'm a member of the ADAA Public Education Committee, which has produced the series of monthly webinars. Before we start the webinar, I'd like to run through some of the guidelines we'll be following for this webinar. Now, on the right side of your screen, you should see a Q&A panel. There's a little field at the bottom of that panel, and when you click in it, you can type in a question, then either hit your Enter key or click the icon. You can ask questions at any time, and we'll try to get to as many as possible. Other participants cannot see your questions, so do feel free to type in your questions. Now, we have 3 speakers for today's presentation, and we will answer some of the questions after the second speaker speaks, and then we'll take the rest of the questions at the end of the webinar presentation. We may not have time to get to your individual questions, so we apologize if that is the case. You should be listening to this webinar through your computer speakers. You do not need a telephone connection. If you've dialed in, please hang up and turn up your computer speakers. Before we begin this presentation, I'd like to tell you about ADAA, or the Anxiety and Depression Association of America. It was started in 1979, and today it is the leading nonprofit dedicated to increasing awareness and education about anxiety disorders, depression, obsessive-compulsive disorder, post-traumatic stress disorder, and related illnesses. ADA's mission is to improve diagnosis and promote the prevention, treatment, and cure of these disorders through education, practice, and research. ADAA fights to end stigma by promoting the message that they are real, serious, and treatable. Please visit the ADAA website. That's www.adaa.org, which includes Find a Therapist, a searchable database of treatment providers, as well as free educational information and resources, self-tests, self-help groups, clinical trials, and a lot more. You can support ADA's efforts, such as this webinar series, by making a charitable contribution on the ADAA website. We are recording this webinar, so it will be available on the ADAA website at a later date. Now, let me introduce our speakers for today. We have Melanie VanDyke, Clark Kebodeaux, and Hedva Barenholtz. They will address how pharmacists can be a resource for people with anxiety and depression. Melanie VanDyke is an assistant professor of psychology at St. Louis College of Pharmacy and a licensed psychologist at the Center for OCD and Anxiety-Related Disorders at St. Louis Behavioral Medicine Institute. Clark Kebodeaux is a board-certified ambulatory care pharmacist and a clinical assistant professor of pharmacy practice and science at the University of Kentucky College of Pharmacy. Dr. Kebodeaux also has experience with medication therapy management, health testing, and immunization delivery. Hedva Barenholtz is a board-certified pharmacotherapy specialist and a certified geriatric pharmacist. Dr. Levy is also the director of HBL Pharma Consulting. Now remember, you can type a question at any time, and we'll get to them later. Now let me turn it over to our presenters. We'll start with Dr. Melanie VanDyke.
Hello. Tonight, I'm looking forward to introducing you to my pharmacy colleagues, perhaps the most accessible healthcare providers. Your pharmacist can address your unanswered questions regarding medications. And that can be particularly helpful as anxiety and depression can both interfere with you asking questions during your scheduled doctor's appointments. Pharmacists are consistently rated as one of the most trusted professionals in healthcare. Pharmacy education specifically focuses on how to best address the patient's needs. For instance, pharmacy students are trained to ask open-ended questions using the teach-back method, and this results in people knowing more about their medication. In one study, they found that after even a brief 2-minute discussion, patients were better able to recall that basic information about their medications. Pharmacy services also improves treatment outcomes. People feel better, and they're able to get back to their regular activities. Pharmacist communication about antidepressant medications has been shown to help people take their medication more regularly, be more satisfied with their treatments, and have more positive beliefs about their medication. And intensive psychiatric services in pharmacy have been shown to improve treatment results and reduce medication side effects. Dr. Kebodeaux will begin his talk tonight with an overview of the pharmacist's role in healthcare. Pharmacists are increasingly a part of the multidisciplinary healthcare team, serving as the medication expert. Also, pharmacists are connected to the medical specialist that a person may be seeing, and this makes them particularly well-suited to help patients navigate through the complex healthcare system. In addition, patients trust their pharmacy services, and those who have an established relationship with their pharmacist have welcomed them into their behavioral health care. This evening, we're going to review questions that you may want to ask your pharmacist to better help understand your medications, as well as discussing pharmacist services such as medication therapy management, an individualized discussion of your medications. Now, you might be wondering, who is it that can benefit from medication therapy management? And a real simple answer is that anyone who uses medications that are prescription or over-the-counter, anyone who uses herbals or dietary supplements, has the potential to benefit from medication therapy management, but the people who are going to most benefit are those who use several different medications, who have several different health problems, anyone who has questions or problems with their medication, anyone who's taking medications that require close monitoring, such as lithium, those who've been hospitalized, and those who get their medications from more than one pharmacy. That way there's not one pharmacist that can do overall oversight for all their medications. So for instance, people who have diabetes, hypertension, and depression, who are taking more than 5 medications a day, are going to be pretty likely to benefit from MTM. Another service that pharmacists can provide is screening for depression. Pharmacists have been shown to be able to identify depressive symptoms and refer people who are at high risk for depression. Pharmacy screening can be particularly important since some people are hesitant to contact a mental health provider. Pharmacists also can help people make decisions about their medications. Older adults who are educated on the risks of certain anti-anxiety medications were found to be more likely to talk to their doctor and/or pharmacist, and were more likely to reduce their use of these potentially harmful medications. Physicians, pharmacists, and patients all recognize that pharmacists are the experts regarding medication use, side effects, and interactions. Tonight, Dr. Levy will walk us through the process of selecting medications for anxiety and depression. One way that pharmacists may be helpful for these medications is working with doctors and patients to develop strategies for dosing, switching, and discontinuing drugs safely. Pharmacists are well positioned to support safe medication use, as they are often the first to know when people are having trouble with their medications. In fact, we know that some people are more comfortable telling their pharmacist about problems with their medication before they even talk to their physician. Pharmacists are trained in the proper use of both medications that are prescription as well as over-the-counter medications. In addition, pharmacists understand how these medications may interact with each other, as well as how they interact with dietary supplements or even certain foods. Our last topic this evening will be medication review services. Medication reviews have been shown to support the best use of medications and reduce the use of potentially harmful medications. So let's begin with Dr. Clark Kebodeaux discussing the role of the pharmacist.
Thank you, Dr. VanDyke. My section of the talk today is going to focus on pharmacy services and maybe discuss different opportunities to interact with your pharmacist, ways you may not have in the past. Pharmacist's role in healthcare has been defined by a concept called pharmaceutical care. And this isn't unique to just the past few decades, something that's been happening throughout the history of the profession, but particularly when we want to define pharmaceutical care, what a pharmacist does. And you can see the definition there on the slide. Providing drug therapy to help achieve outcomes that improve a patient's quality of life through 4 different ways: curing a disease, eliminating symptoms, slowing a disease process, or even preventing disease in the first place. A few examples might be the provision of necessary medications to cure a disease or treat symptoms. Arresting or slowing a disease process may be working with a patient in order to help prevent future issues related to that disease or related symptoms. Dr. VanDyke discussed the pharmacist or the medication expert within the healthcare team. Most patients think of pharmacists when it comes to prescription medications or when I go to pick up a new prescription or get a refill for a medication. But we know that it's not just limited to those that are available with a prescriber's prescription. There are also hundreds of thousands of medications over the counter that are available to patients. Oftentimes, while prescription medications are seen with a certain level of severity and issues and seriousness, over-the-counter medications can play just as big a part in drug interactions as well as treatment, curing, arresting, slowing disease, as you saw in the previous slide. In some cases, patients are getting medications from different physicians. You may go pick up a medication from your primary care physician, but have a specialist to treat certain other diseases. And in fact, in certain cases, the prescribers may not know exactly what's going on. This makes the pharmacist the perfect person to be at the central part of the healthcare team to monitor for things like drug interactions. Certain drugs may actually affect the ability for other drugs to work effectively, and the pharmacist is there to catch those. All of these different ways the pharmacist can hone in on the medications make the pharmacist an essential member of the healthcare team. What you see in front of you here is a very convoluted picture of the healthcare system. You may see this and go, this slide's a little confusing. Well, it actually depicts how you, the patient, if you see that star in the top left-hand corner, interacts with the healthcare system. Perhaps it starts with a type of insurance. Who do you get insurance from? Do you get it from Medicare? Do you get it from your employer? Well, if it's Medicare, there's 4 different parts of Medicare. And now that you have this insurance or the ability to potentially afford care, where do you get it? It could be at the VA, the hospital, the doctor's office. And from just that hospital, there's 4 different types of hospitals, from nursing homes to private and public hospitals. And even breaking that down, all of those different insurances and physicians and hospitals interact with different partners, from the government to those who develop drugs and other federal organizations. Now, all of this may seem overwhelming and confusing, and at times it is, but this is here to reinforce the role that the pharmacist can play in helping to navigate the healthcare system. Pharmacists constantly interact with those who write prescriptions, as well as insurance companies who control what and when can be filled. At the same time, too, when patients leave a hospital, oftentimes the next person seen is a pharmacist, and they play the role of reconciling the different medication lists that happen as part of that. So this slide really is to summarize, to reinforce the important role a pharmacist can play in helping to navigate an otherwise complicated healthcare system. So, to break it down simply, how does someone typically enter the healthcare system? As you can see from the left, a depiction of a patient there, often feels sick or something's not right, and in that case goes to approach their physician. That could either be their primary care physician, a specialist, or maybe even urgent care or an emergency room. In that case, that prescriber makes a diagnosis and usually provides some sort of treatment. Oftentimes in the form of a prescription, the patient then navigates that to the pharmacy where the medication is appropriately dispensed. And I would say this is what happens every time there's an acute issue. Something's not right, something doesn't feel well. The healthcare system interacts when each of these three entities play a larger part together as part of the healthcare system. And that's something called prevention. So for example, not just picking up a medication every time something is wrong, but engaging with your pharmacist, engaging with your physician, and yourself too when it comes to educating, things like attending the webinar today, to really learn how I can prevent these things from happening as opposed to waiting until I'm sick in the first point. The part is all three parties can be engaged throughout the process of care, so it's not the simple sick, diagnosis, treatment, and the cycle repeats itself. Each healthcare provider, and including you, a very important part of the healthcare system, can play a role in preventing future disease. A good example of this is defined as the medical home. This was defined when passing with the Affordable Care Act in 2010, but describes a healthcare system in which the patient's primary care physician kind of serves as the quarterback of the team. In that case, the pharmacist has an important role in the medical home. As mentioned and described earlier, the pharmacist can really hone in on the medications and maybe help decide what's appropriate for the patient and what times it's appropriate for a patient to seek care with a provider, or maybe it's something that can be treated with an over-the-counter medicine. And pharmacists can also help prevent healthcare. A good example of that is immunization delivery. Here you see a time map described pharmacists' ability to immunize in the United States. And while this doesn't specifically deal with anxiety and depression, it's a microcosm or an example of how when the patients, pharmacists, and the whole healthcare community come together, realizing the opportunity that pharmacists can play. In a short time, in just the last 10 years, you can see to well over 200,000 pharmacists now trained and immunizing in all 52 states and territories. There was a need with the H1N1 epidemic, and pharmacists were there to step in, show their ability to counsel and work with patients, and provide care when needed. So now that pharmacists can play a larger role in the prevention of disease through immunizations and other ways, how can you get involved if we talk about that part of the healthcare team? Well, here's some examples of questions to ask your pharmacist. Dr. Barenholtz-Levy is going to go into more detail in her section of it, but you can see 5 quick examples, just kind of knowing what's about the medication, what information do I need, when should I take it, what are some things to expect, and what happens if I miss a dose. Like I said, that'll be covered more in the second half of the presentation when it comes to very specific medications. All of them are great examples for you to learn more about your medications, and even in a busy pharmacy environment, serve as an opportunity to take a moment, stop, and make sure that you're getting the most from that prescription. Dr. VanDyke introduced the concept of medication therapy management. This was passed as part of something that happened when Medicare Part D came out in 2006, an opportunity for the pharmacist to sit down with patients and go through their medications and complete a full medication therapy review. Dr. Barenholtz-Levy will talk about the bones of that review and what exactly that looks like, but what I want to share is the opportunity for you to potentially engage in medication therapy management by asking your pharmacist or your insurance company opportunities to seek out this a chance to do with a pharmacist. It's possible that the pharmacist may seek you out as well if you're eligible, but this is something too that, like we said, when we talk about the whole healthcare system looking for opportunities to prevent problems, and a medication therapy review is a perfect example of that. Pharmacists, in similar fashion to medication therapy management, have served as disease management coaches. Insurance companies have looked to pharmacists to help control things like diabetes in a way that could be very consistent with anxiety and depression, monitoring over time to really help reduce the burden of disease. Examples of wellness and public health are demonstrated earlier when we talked about immunization. And there are other clinical services that are important, such as screenings, for example. It's not uncommon to have a pharmacist measure your blood sugar for your risk for diabetes, your blood pressure for heart disease. And one thing we're going to talk about today is screenings related to anxiety and depression. When we talk about how much money is spent on medications every year, I want to give you the large number of how much the United States spends on healthcare every year. And it's about $2.8 trillion. A little over 10% of that, or $290 billion of that $2.8 trillion, is actually due to inappropriate medication use in the United States. I share this number with you today as an example of how the pharmacist can help, not just the patients, but the whole healthcare system by reducing the amount of drug interactions that exist. Maybe patients taking inappropriate medications that they did not need, or taking medications not as prescribed in the first place. Pharmacists and patients together can truly make a difference to not just help patients, but save the whole healthcare system money. Now, part of this you might think, how do I interact with the pharmacist the most? The most traditional way is in a community pharmacy, and you might see examples such as large chain pharmacies with multiple locations throughout the United States, grocery stores or independent drug stores also located throughout the United States in specific communities. Well, pharmacists aren't just limited to in the community. They're also in the hospital. It's likely that if you've ever got a medication in the hospital, the pharmacist was in charge of making sure that was an appropriate and correct medication. At the same time, too, pharmacists are part of that team in the hospital, maybe deciding what treatment is right for you. Managed care pharmacy is an example of how pharmacists can be involved in your insurance to help design what medications are appropriate for certain conditions. Pharmacists are academics teaching the next generation. Also, they play a large role in the VA, in the armed forces, where pharmacists actually prescribe. Lastly, the pharmaceutical industry, the ability to design drugs as well as patient information to help make sure that these get used appropriately. One example that could occur during a medication therapy review could be a quick screening for depression. An easy way to do that is a quick question here, written on the slide. For the past 2 weeks, how often you've been bothered by any of the following problems? Little interest or pleasure in doing things, or feeling down, depressed, and hopeless. And based on your response to those questions or a patient's hypothetical response, it may be appropriate to do a more in-depth screening tool to identify and treat anxiety and depression. Now, you don't have to just wait for your pharmacist to ask this question, although it's likely that during a review they could seek treatment. For example, 1 in 5 patients with diabetes is depressed. Now, the level of treatment in patients with diabetes doesn't nearly meet that 20% goal. And that's why we talk a little bit about the ADAA website referenced earlier. Say a pharmacist sought you out. It's possible that if that didn't happen, you also have resources here as well. An example of a more in-depth screening form is there on the website, the Screening for Depression, a 9-question tool that can truly help define your risk for depression. This is something that can be shared with the prescriber when a medication or other cognitive behavioral therapy may be appropriate. Other resources on the website include screening for generalized anxiety disorder and something, too, that you can share with members of your healthcare team. Now, medications only work in patients who take them. So a couple examples of that. Oftentimes, we all forget from time to time, and one of the things that really can truly make a difference in treating anxiety or depression is taking the medications as prescribed. There are things that pharmacists can do to help you adhere to medications. So, for example, maybe organizing things in a pill box. Or there's a variety of technology, including medication apps, that can help really group, if you have multiple medications, into convenient times per day. I've encountered situations where I've interacted with patients, and in that case, they've taken all throughout the day or maybe been confused on what's the appropriate time to take it. What I try to do is group them into different sessions, such as morning, lunchtime, dinner, and bedtime, and really then looking for opportunities to help patients organize and get the most from their medications. And lastly, the most important thing you can do, ask your pharmacist. There's no reason to not seek out help. They're professionals. They say 95% of people in the United States live within 5 miles to a pharmacist or can even call. Many pharmacies are open 24 hours a day. So I'll conclude my section with the perfect team. I suggest you and the pharmacist can both prevent healthcare as well as cure and do all different parts of providing pharmaceutical care. And with that, I'll pause a few minutes in case there's anyone who has any questions before I turn it over to Dr. Levy.
Dr. Kebodeaux, there is a question I have for you. This is, if there is an issue with my medication, should I call my doctor or pharmacist?
Great question. In this case, it's not uncommon that the physician was the one that maybe prescribed the medication and the pharmacist was the one who dispensed it. If something did happen, either can be a valuable resource. In some cases, it may be a little bit more difficult to reach the physician in the sense that depending on whether it could be after hours and you may or may not be able to reach that physician, what I'd suggest is calling both, maybe reaching out to the pharmacist if there's a medication-specific question, and then following up with your physician or asking the pharmacist to do so. So what I'd suggest is both are a resource, and I would try to reach whichever one you're able to in that time frame, but really, allowing both to communicate and help if the question is related to specifically to the medication. Good question. Thank you.
Okay. There's another question. Is there a difference between generic and brand name drugs?
That's a great question. So when it comes to the active ingredient in the medication, they are the same. Now, the inactive ingredients may differ a little bit from the brand manufacturer to a generic manufacturer, but they must meet strict FDA standards that show that that drug works equivalent to the brand name medication. So I always tell patients you can be confident that even when a brand name goes to generic, that you're getting the same amount of medication that you before and has to be proven to be just as effective as the brand name. Great question.
Another question. If I get my medication from mail order, who can I talk to about my medications?
So that's a unique situation because in some cases you may not have met the pharmacist that you have that dispensed the medication from mail order. All mail order pharmacies are required to have pharmacists on call. So I'd encourage you to start there. But if you are in there, there's no pharmacist that will not help you just because you may get your medication somewhere else. I'd encourage you to seek out help from your local pharmacist or use the resources available to reach the mail order pharmacist as identified on the prescription label.
All right. I think we will now move on, and Dr. Levy can start her presentation. Dr. Levy, over to you.
Great. Thank you very much. So my section of the webinar will focus on more specific issues regarding medication use, namely how patients can use their medicines more safely and effectively. On this slide, I wanted to comment that previous webinars have addressed medications that are used to manage anxiety and depression. And because we won't be going into too much specifics about the medications today, I wanted to make sure you were aware of these past webinars. So if anyone's interested, they can go back to the archives. The web address is up here, and you can access those. And I want to do a big shout out and apology for the typo on this slide, the ADAA. The next slide highlights the different medications that are used for treating anxiety and depression. The ADAA website also has a specific medication information on their website. The web address, the URL, is listed at the top here. But I've presented the main medications that are used to treat anxiety and depression. The most commonly used medicines are on this slide here. You can see that the SSRIs and the SNRIs are two drug classes that are often preferred for treating both anxiety and depression. I've also listed on this slide more other specific different drug classes or specific medications that are used either for treating anxiety, found in the left column, or depression, found in the right column. This is a good time to remind us that all medications have two different names, the generic name and the brand or the trade name, and I've provided the brand names in parentheses here on this slide. To avoid confusion and possible medication errors, I recommend that you become familiar with both drug names whenever possible for the medicines that you're prescribed. However, this talk is not about the specific drugs, rather how to use them more safely and what questions you would want to ask your pharmacist about. On this next slide, I wanted to share some research about how medication use is quite prevalent in the U.S. Recent data shows that 59% of adults in the U.S. have used a prescription medicine in the past 30 days. And this is up from 51% in 2000. Use of 5 or more prescription medications has nearly doubled in this time period from 8% up to 15%. Older adults are generally defined in medicine as aged 65 years and older, typically take more medicines than the general population because they have more medical issues that typically require more drug therapy. And indeed, they typically use more medications. So data from 2012 show that 39% of older adults take 5 or more prescription medicines regularly, and this is up from 24% in 2000. Certain drug classes have accounted for a lot of this increased prescription medicine use. For example, certain cholesterol medicines have their prescriptions are have grown much in the last 12 years, as have antidepressant medicine use, and we've largely seen a growth in the SSRIs and SNRI types of drugs prescribed. Another important statistic at the bottom of the slide is that 25% of adults do not tell their doctors about non-prescription drug use. And this becomes important when we think about the interactions between prescription and non-prescription or OTC medicines, as Dr. Kebodeaux talked about how many, many different non-prescriptions are available out there. This is a great example of why your pharmacist is such an important part of that healthcare team, as we just talked about. Use your pharmacist to check for drug interactions, especially if you are using some non-prescription products along with your prescribed medicines. Choosing a medicine to treat either anxiety or depression must be highly individualized for each person. Things that a physician might consider include other medicines that the person's taking and other medical conditions, because many of the medications can interact either with the medical condition or with other drugs. We think about cost of therapy and whether insurance will cover the medications. Generic medications generally are preferred, and I'm glad we just had the question about generics versus brand name. They're generally considered the same as the trade name, the same active ingredient, and they're at a much lower cost. When treating depression, drugs that have worked in the past for a patient generally are preferred to try something similar or the same medicine again. And also knowing what side effects were troublesome for a person in the past can help steer the doctor away from that type of side effect when choosing another medication. Drs. Kebodeaux and VanDyke already mentioned adherence to medication, that is, taking the medicines as instructed, and how important that is. Typically, we look for once daily medicines whenever possible because that's the easiest for patients to take and remember every day. Another example would be if a person has difficulty swallowing tablets, for example, that would make it difficult for them to adhere to their medication regimen. We can look for a liquid or a quick dissolving tablet, for example, that might be a better match for the person. Choice of a medication might depend also on the goals of therapy. Factors like how severe are the symptoms, or if it's a first versus a recurrent episode, need to be considered. You and your doctor should talk about the goals of therapy before starting any medication, and also what kinds of things are important to you in managing your health. Risks and benefits of the drug therapy is also important to consider. What are the side effects of the different medication options? How effective are the different options? Each of you as a patient has issues that are important to you, and what matters most for one person might be different than what matters to someone else. So some examples I think about would be side effects. There's the medicines vary to the extent of how they might have differing sexual side effects or stomach side effects or even weight gain. So what's important is to understand what matters to the patient and find the best match for that person. And finally, non-drug treatment options should be discussed as well. For example, is psychotherapy going to be part of the treatment? What about exercise? And how will these fit into the overall plan? So when choosing a medicine, the prescriber really needs to know all of the medicines that you take, along with all the other health conditions, any other health conditions. It's important to carry a complete list of all your medicines with you. So I'd like to emphasize here that this involves 3 different categories of medications that you want to put on your list. Prescription medications, non-prescription or OTC medications, and supplements or herbal products. Supplements are things like omega-3 fatty acids or fish oil, St. John's wort, garlic, glucosamine, for example. There's many, many, many out there. Very often when I meet with my patients, they tend to focus only on the prescribed medications and forget to include these non-prescriptions or OTC products like aspirin or vitamins, even eye drops. They all need to be included in your medicine list. Remember that the pharmacist may be the only healthcare professional who really looks at everything you're taking prescribed by all your different doctors. So it's very important that you keep a current list of your medicines and share that with all of your prescribers and healthcare team. So once a drug is selected, we want to optimize the dose. We want to make sure it's the most effective dose and the safest dose possible for you. Too much of a drug will lead to side effects. Too little of a drug will not be effective. Medications typically have a starting dose, which is then slowly increased to an effective or therapeutic dose. And sometimes there's a slightly lower maintenance dose once the symptoms are improved and stable. So it's important to start with lower doses of a medicine and increase that dose slowly to get to the therapeutic dose. One reason for this is so we can allow time for the drug to take effect. Most antidepressants take 4 to 6 weeks to become fully effective, so it's important not to increase the dose too soon. Also, by going slowly with the dose increases, starting low and increasing the dose slowly, we can avoid or at least minimize the side effects. For example, side effects like drowsiness or nausea typically can be minimized if we start with low doses and increase slowly. All the information I've just talked about that goes into choosing a medicine is part of what we call person-centered care. And this is a philosophy in healthcare in which we recognize the importance of including each person's preferences and goals of treatment when developing a care plan. Next, I want to talk about general principles of safe medication use. When I talk about using medicine safely, I like to use the analogy of safe driving practices. So think about when we drive a car, we make sure to wear our seat belts, and we use our turn signals and check the tire tread before we drive long distances. We make sure the oil is changed and things like that. In the same way, we need to be mindful of how we take our medicines as well. So remember that these tips apply to anyone who takes medicines for any type of condition, from high blood pressure or diabetes to anxiety and depression. So I'm going to go through each one of these briefly. The first tip is to read your prescription label and the instructions each time you take your medicine. This might sound silly, especially if you've been taking the medicine for many months or years even, but sometimes the doctors might change the instructions based on something new that happened at the last appointment. It happens, unfortunately, more often than I'd like to think. When I meet with a patient, they've been taking a medicine once a day, for example, and the prescription label says twice a day, and they never realize that it's been changed or whatever might have happened. But it's important to look at that label. Especially if you take more than just a couple of prescriptions on a regular basis, reading the label each time can prevent medication errors. So it's another tip, way you can be more involved in your health care. Number 2 is to know when a refill is due. This is important for medicines that we use for treating depression. Drug therapy needs to be taken daily to be effective on an ongoing basis. So running out of your medicines for depression or anxiety can lead to a recurrence of the symptoms sometimes, or even symptoms from not taking it. Sometimes our body gets used to the medicines, and when we stop taking it abruptly, we can actually have symptoms, withdrawal-type symptoms. So getting a refill late might be a problem in certain situations. Generally, we say call your pharmacy when you have 5 to 7 days worth of medicine left. That would give the pharmacist time to make sure the drug is in stock and that it's ready for you when you need it. Use a reminder system for taking your medicines. As I just mentioned, drug therapy has to be taken on a daily basis to be effective, so it's important to not forget. Sometimes we're human, it's hard to remember medicines, and every day can be very challenging, but Dr. Kebodeaux talked about different ways to help you remember to take your medicines regularly. Number 4 is to get lab tests and monitoring done as instructed. For some of the medicines, it can be very important. An example here is lithium, where we need blood level tests done as well as monitoring electrolytes. So the need for lab tests really vary from patient to patient based on what they're taking. I've already mentioned the importance of keeping a complete medicine list. Number 6 is to write down questions between your doctor visits. I encourage this for all patients because it's easy, way too easy to forget an issue that comes up in between your visits. For example, maybe you notice a symptom that may or may not be related to a new medicine that you're taking. It might go away or you might not think about it later, yet it could be important to share with your doctor. So writing down your questions in advance of an appointment also helps you make good use of the doctor's time during that appointment. By letting the doctor know that you have certain questions that you've prepared in advance and you want to get answered at that visit, the doctor can address them more efficiently during the visit, and you have a space even to write down answers that you get from your physician. And finally, I encourage everyone to communicate with your healthcare providers, your pharmacists and your physicians especially, about any concerns or observations you have about your medicines. We as healthcare professionals don't know about problems or concerns that you have about your drug therapy unless you tell us. So while pharmacists are trained to focus in on very specific drug questions, the doctor may not think to ask you about being able to afford the medicine or are you taking it regularly. Remember that no question is silly or unimportant. If you're not taking the medicine like you're supposed to, or there's a cost issue, or you have a concern about side effects, you need to let the doctor know so that we can, the physician and your pharmacist as well can provide more focused, more appropriate care to meet your needs, and this goes back to that idea of person-centered care. I also recognize that some of these recommendations might be more challenging if patients have severe anxiety or depression symptoms. It could be hard for someone to feel comfortable making the phone call for the refill or going into the pharmacy to get the medicines, or even have the motivation to follow through with getting a lab test drawn or sharing concerns with your healthcare providers. But hopefully you can understand why it's so important and feel more confident that you can do this. So I want to shift now to talk about that medication review process. We've mentioned that earlier in this webinar. It's not a new concept, but it's getting more attention recently. As we mentioned, the Medicare Part D has brought it to the forefront a little bit with the medication therapy management component. Very simply stated, a medication review is a systematic way to gather and review a person's medication use information. They're important in many different ways. At the very basic level, it's a great opportunity to educate patients about the medicines they take, how to take them, why they're taking them, etc. It also allows me in many cases to educate the prescriber about a person's medication interactions or side effects or anything that's going on from the patient's perspective regarding the medications that the doctor may not know about. Ultimately, the goal of a medicine review is to prevent medication-related problems, which include things like improper dosage or interactions. A review also provides the opportunity to monitor for side effects and interactions, and I think very importantly, educate the patient about possible side effects and interactions so they can be part of watching for any issues. And perhaps most importantly, when we do a medication review, it's the chance to find things that no one really even knew existed. And many more times than I'm always surprised when I find things that we never thought to think about, yet by speaking with the patient about all the medications they're taking and how they're taking them, issues rise to the surface, and that leads to overall better care of the patients. So on this next slide, I bring up questions about when you should consult a pharmacist. So personally, I think it's important to talk to your pharmacist anytime you have a question about your medicines. A more careful review might be appropriate if you take multiple medications, and there's no specific cutoff, but I could say 5 or more as a common threshold. If you have more than one physician prescribing medications for you, if you use non-prescription products or supplements, and anytime a new medicine is added or you have a change in symptoms, a pharmacist can help figure out if that new symptom might be because of a medication or if it's due to something else. So we're a good resource. An informal consultation might be all you need for a simple question, something about a new medication or if you need help in choosing an OTC product. This is what we do every day in the community pharmacy. We're very easily accessible and easy to reach. So those informal consultations are very simple. A more thorough medication review, though, is something a little different, and I'll describe more of what that involves on the next slide. But these more complete reviews take time, and there's typically a charge for these consultations. Insurance might cover the cost in some cases, as with Medicare Part D. Sometimes a pharmacist might have an arrangement with an insurance company, but another alternative is to simply pay cash for a medicine review, what we call private pay or fee for service. So you would need to check with your pharmacist about the fee and if the pharmacist provides your service, or check with your insurance company. And as Dr. Kebodeaux had mentioned, being proactive in, the pharmacist might reach out to you for a medication review, but you can also be proactive to ask if these services are available. So what goes into a medication review? I break it down into things from the patient's perspective and things from the pharmacist's perspective. So from the patient's perspective, I want to know what the patient understands about his medications and if he's taking them properly. Does the patient think the drugs are effective? Are they causing any side effects? Is the patient able to adhere to that medication regimen? Are there any barriers that we can talk about and correct? How's the patient doing with incorporating any non-drug approaches to manage their condition? Things like participating in talk therapy or exercising regularly. And then I do my behind-the-scenes evaluation, in which I look for things as a pharmacist, like choice of drug based on the patient's medical conditions and other medications, drug interaction and dosages of medicine based on the person's kidney or liver function or other medical conditions. As part of the medication review, I also ask about alcohol use, smoking, nutrition, how their meals are, how often they're eating, and immunization status. This is all part of a comprehensive medication review. Remember that with anxiety and depression medicines, as well as many other kinds of medicines, these drugs can interact with alcohol and lead to some serious effects at times. Sometimes people may not feel comfortable sharing with their doctors certain information, such as if they're drinking, or how much they're drinking, or if they're skipping doses of medicines. And they might be more comfortable sharing this information with the pharmacist. I find that once I've established a rapport with the patient, they're often more trusting and will share different things with me than they might be sharing with their doctor. And this again leads to overall better health care for the patient. I also find that patients appreciate just having that specific care and expertise of a pharmacist with whom they can talk about their medicines when doing these more thorough medication reviews. So now, to wrap up, I wanted to go over these 8 things you should each know about your medications. Dr. Kebodeaux had touched on this earlier in his portion, but I believe there's value in repetition, and so I wanted to go over these again with you. Everyone should know the name of the medication that you're taking. Remember that each medicine has those 2 names, the generic and the brand or trade name. You should know why you're taking the medicine. When do you take it? In the morning or at bedtime? How do you take it? Does it have to be taken with food or on an empty stomach, for example? What do you do if you miss a dose? Typically, we say never double up on your medications, but depending on how many times a day you should be taking the drug, you typically need to call your pharmacist to find out how to handle a missed dose. Do you need to get a refill of the medication? As I mentioned before, it's important not to skip dose, or not to let a lag go before getting your refill. For many conditions, including anxiety and depression, the treatment is ongoing for many months, if not longer, and so most of the medications are refilled for an ongoing period. You should know possible side effects of your medications. You should be familiar both with common side effects and how to manage it, like dry mouth, or if it bothers the stomach. We have easy fixes for some of those things. But you should also know what are the serious side effects, and when do you need to contact your doctor. For example, if there's vomiting or bleeding or something more serious that you notice. Important interactions with your medicine. Here I'll mention again the interactions with alcohol, as well as food, and the non-prescription, the OTCs and supplements as well. And certainly with the medicines we use for anxiety and depression, interactions can be an important concern. So bottom line, with all of the information the 3 of us have presented in this webinar, hopefully we've made it clear and given you a lot of good information for understanding that pharmacists are here to help you understand the medicines you take and also how you can use your pharmacist more to improve your overall care. And with that, I want to turn it back over to Dr. VanDyke and the rest of our questions.
Excellent. And so I wanted you to have available the ADAA resources that we referenced throughout the talk, put them in one convenient place for you as we take your questions.
Right. We have a question here. Can some of the inactive ingredients in generic medications affect the way that they work? I think this is probably a question for Dr. Kebodeaux.
Could you please repeat that question? I heard it, but like, was it the formulation? Sure. If you could repeat it for me one more time, I'd appreciate it.
This is what is written. Can some of the inactive ingredients in generic medication affect the way that they work?
In general, these don't have any sort of pharmacologic property, meaning it's typically a different type of sugar or lactose or something like that that simply make to look the tablet the way they do. So in most cases, it's assumed that they do not.
And I would only add to that, the inactive ingredients won't affect the effectiveness of the drug at all, but they could contribute possibly to a rash or, if there's any allergy issues, something like that. Those inactive ingredients do vary product to product.
So we have another question here. How big a problem is drug interactions? Dr. Levy, I think you talked about that. Maybe you can elaborate.
Drug interactions are, I always say it's challenging to discuss in a group setting. Interactions are quite variable person to person. It really depends on the combination of medicines that are involved, even medical conditions. An older adult, I work a lot with older adults, and they're more susceptible to having symptoms, problems from the interactions. Many interactions occur but don't cause symptoms. They're not clinically significant, if I can say that. It's the ones where if it's a significant interaction, it leads to symptoms that becomes a problem. So there are many, many, many interactions out there. Which ones are going to be important for a specific patient really comes down to meeting with your pharmacist and really looking at your specific medicines you're taking. I think that's the best answer I can give. Dr. Kebodeaux, if you have anything to add to that?
The statistic I talked earlier about the cost of inappropriate medication use, drug interactions that result in, maybe like a hospitalization or a physician visit are accounted for in that number. So it is something that the healthcare system can get better at, but I don't have the exact percentage of, say, that $290 billion that's due specifically to drug interactions.
All right, we have an interesting question here. Somebody has asked, can we feel safe asking the pharmacist about interactions between illegal drugs like marijuana or cocaine and prescription meds? How do pharmacists handle this? Would you be able to give her an answer?
I can take a try at it if you want, Dr. Levy.
You first.
What Dr. Levy talked about, and I kind of alluded to too, is there has to be a trust between the pharmacist and the patient. And I have had patients that have asked about interactions with drugs with, what consider controlled substances. And I think the most important thing, in addition, to obviously talking about the use of those too, is making sure that you're living as healthy and the patient is, being as healthy and prevent as drug interaction as possible. So there are databases that have some information on drug interactions with illegal substances. I would encourage you to ask, only because that honesty, is protected in the sense that it's something that's communicated to your healthcare provider. But I will tell you that the information is not as consistent because, for example, most drugs aren't tested against their interactions with marijuana. Most of that information that we have comes from individual case reports, but it's not studied on a larger level, like if a medication such as Lipitor we know can interact with other medications that are commonly on the market because it's tested along the way. It's not tested along the way about illegal substances. So to summarize, I think it is something to make sure to ask about, and it's part of that trust and relationship. At the same time, too, it's possible the pharmacist may counsel on, how to potentially stop the use of those substances. But at the same time, we do have a limited amount of information related to that. Dr. Levy?
I would only add or emphasize that I think I would err on the cautious side, and yes, share it with your pharmacist. We're here for your overall health, and mixing prescribed medicines with, even if it's illegal substances, there might be some information we can guide you on to at least use your medicine safely, and of course look at your overall health. And I would go with it's a confidential relationship. It's looking at your overall health, and I think that rapport and trust is you would have that with your pharmacist. So I think I would just concur with what Dr. Kebodeaux said.
Yeah, great question.
All right, I think we've come to the end of our webinar. I would like to thank all the presenters, Dr. VanDyke, Dr. Kebodeaux, and Dr. Levy, for a very interesting and informative webinar. Thank you all for attending this webinar, and we hope this was helpful. Please let others know about this series and consider making a contribution to ADAA. Thank you, everybody, and good night.
Good night.
Thank you.